It gives me great pleasure to introduce Judith Glynn, who is currently in the final stages of completing her PhD program at the Center of Excellence in Responsible Gaming at the University of Gibraltar. Her latest research focuses on the role of gambling in society, particularly in public policy, legal, and regulatory frameworks. Judith's career has spanned several decades, which included being part of a small team that created the legal and public policy framework as Ontario expanded its gambling venues. And from there, Judith managed the world's largest gambling research program at the Ontario Problem Gambling Research Center. Judith has shared her expertise with entities across Canada, the United States, and internationally. Judith is a progressive thinker, and when I first came across Judith, it was during a New Horizons conference back in March of 2020, just before we were all quarantined for COVID. Several of the presenters were asked to ponder future proof of gambling, and Judith's paper and discussion focused on player safeguards and prevention. And as someone who was fairly new to this work at that point, her concern to better protect concerned others, questioning how player data can be leveraged to reduce harm, and calling out the need for all operators, regulators, and gambling consumers to each contribute to harm reduction and making gambling safer for all, really resonated with me as I look for ways in which M&APG can be most effective in accomplishing one of our goals, which is that fewer Minnesotans experience gambling-related harms. I'm a huge fan of Judith's work and the lens in which she approaches safe gambling. Please join me in welcoming Judith Glynn.
I'm a little shorter than Susan. There. Can everyone hear me? Oh. How about that? All good? Thank you so much, Susan. That was very kind. I'm very grateful to be here today. So hello, Minnesota. First time here. It's the state home of my favorite aunt. So I was with her last night. I'll be with her again tomorrow night. She always visited us. Now that she's elderly and in a nursing home, this invitation couldn't have been more lovely timed. So I've been able to combine that with coming here and talking to you about something that I feel very passionately about, and I know that Susan does as well. And so hopefully, I think my talk will flow into the subsequent ones, and we'll be able to talk about why it's very important and how we can address this issue of third-party harm. So I think Susan told you lots about me. I can tell you that when I was hired in the Ontario government as part of that little team to establish that legislative and regulatory framework, it ignited a lifelong fascination in the decades since with the role of gambling in society and the way in which governments, legislators establish the legality of gambling, the regulatory frameworks they establish, who they define as vulnerable. All of that has fascinated me all my life. And when I got the chance quite late in life to do my PhD a few years ago, I jumped at it. So it's been a real joy. I'm now lecturing there a course called Compliance Leadership, where I teach executives in the gambling sector and in regulatory bodies about money laundering and responsible gambling and regulation in general. So today, of course, what we want to talk about is gambling-related harm to families. So first of all, just to walk you through the order of events, I'm going to talk about the fact that the gambling sector lags other risk industries quite dramatically in this area. I'm going to talk about how hopeful it is that the concept of harm in this field has finally broadened enough to start to have this kind of conversation. I'm going to tell you why I think we have a policy window right now. And someone earlier mentioned, are you working with legislators and policymakers? And I think that we do have that opportunity, and I'll explain why. I'll talk about how we can achieve family-focused harm reduction, both in terms of building on existing programs and some new collaborations that I think could be engaged in. Although here in Minnesota, you're obviously engaged with far more partners than I would have expected before I got to know a little better what you do. And finally, I'll talk about what I think is an early stage, high impact, low barrier, which is to implement a family exclusion process here in the state of Minnesota. And I'll ask you to take that on today. So let's jump in. So the foundation of legal systems in pretty much all of the English-speaking world is a principle by John Stuart Mill called the Mill Harms Principle. And what it says is that the power of the state should not be brought to bear on your individual decisions, even if I find them morally reprehensible, irresponsible, or self-destructive, unless your behavior causes harm to others. And various jurisdictions treat this a little bit differently worldwide. You see variation in what is defined as harm to others, and also in the extent to which states will decide that a certain amount of self-destruction is not okay. And that'll vary between governments that believe much more strongly in individual freedom and others who say, no, at a certain point we will protect people from themselves. But that is a foundational principle. And if we think about gambling and we think about harm to third parties and the almost utter lack of action in this space, it's shocking when you understand this legal basis for our legal systems. If we then think about so as we look at this legal basis, governments tend to express that legal basis in a couple of different ways. So the legal basis is the foundation. Then legislators decide that there are some sectors of the economy that they will regulate. So they'll make a behavior legal, knowing that there is certain risk in making that part of the economy. And they'll regulate. They might regulate so that we aren't price gouged for something that's an essential service. They might, but in any event, there are many reasons to regulate, but the reasons to regulate are largely driven by protection of public good. So when you think about regulatory frameworks, they really take this idea of, yes, we want to generate economic activity in this sector, but we need to protect public good, and we can't expect the private sector or for-profit organizations to protect people. So we have to establish regulatory frameworks to do that job. You'll see that in risk industries like tobacco and alcohol, where there are very clear regulatory frameworks around who can consume the products, where they can purchase the products, where they consume the products, and what time of day they consume the products. And then you'll see policing around excessive consumption of those products. So you see all kinds of regulatory efforts that are brought to bear to minimize the harm from legal economic activity. And then we have the policy basis. So again, that legal system, those legislators express that legal basis through both regulatory processes and public policy. And one of the most obvious ways that's expressed is public health. So this lever of a well-resourced public health system is designed to identify emerging risks in a population, conduct population surveillance to see who is most at risk, what the cost of that risk is, what it looks like, who's being harmed, and then how can we educate people to prevent it, and how can we incentivize healthier behaviors. So you'll see, for example, efforts to reward people for quitting smoking, or incentivize people to take medical exams that they need to have done. And this is the public health system at work. They're educating, they're incentivizing, and they're trying to look after the health of the population. And if you think about public health efforts around things like tobacco, you might see, for example, apps to provide peer support and incentives. You might see pressures on legislators to put warning labels on packages. You might see doctors armed with screening questions to screen patients and then telling them what to do once they see that. So this is another way and another basis upon which that larger harm to families and communities is normally addressed. But again, in the gambling sector, we're very far behind. There is very little kind of public health perspective and voice addressing harm to families in the gambling sector. So greater alliance with public health will be one of my recommendations as we go further in the presentation. But if you think about those three levers, the legal, the regulatory, and the public policy / public health lever, think about these other behaviors like tobacco and alcohol, and you can see how harm to third parties is not only addressed, but in many cases, until harm to third parties was recognized, you got very little effective public policy change. So once you recognized harm to third parties, like from secondhand smoke, that's when you saw real movement on tobacco. And the same thing with alcohol. When you started looking at drink driving and things like that, that's when we really start to see policy change, is when we recognize explicitly the harm to others. And that hasn't happened yet in this sector. So why? Why hasn't it happened yet? So there may be many reasons for that. One of them is a lack of understanding, and that, I would say, is largely because the harm to others has predominantly been attached to problem gamblers, people who develop a gambling problem. Families and others who are harmed by gambling have rarely been looked at independently. It's always been tied to people who develop a gambling problem. And we see that in the evidence. So there was one literature review that was done looking at literature from 1979 to 2016. Tens of thousands of articles, I think in excess of 18,000 articles, of which I think 600 and some said they talked about family harm. Only 53 of them actually collected data from families about the harm that they had experienced from the gambling of a loved one. In preparation for this talk, I wanted to see if things had changed much since 2016. So I went to APA PsycInfo, which is the dominant database for peer-reviewed literature in this field. And I did in 4-year increments from 2009 to present, and I looked at what percentage of the literature looked explicitly at the harm experienced by families. It averaged around 1.3, 1.4%, with a brief rise to 2% right around the time that the conceptual framework for gambling harm was published, which I'll talk about shortly. And sadly, it's dropped back down to 1.3% of the literature. So one of the other things I'm going to suggest is that we need to engage more with researchers and get them talking about and including family harm in their studies more explicitly. And so armed with so little evidence, then we've also got this lack of a strategic effort to tackle this issue. However, I will insist that we know enough to act. And one of the things that has happened that has really stimulated my enthusiasm and my optimism about this is that we finally saw the concept of gambling-related harm broadened. For decades, the concept of gambling harm was just case counting. How many people have developed a problem with gambling and how serious is it? And I would have arguments till I was red in the face with researchers about why they weren't looking at harm in the way that other disordered behaviors were looking at harm. To be fair, gambling was only added to the DSM, the Diagnostic and Statistical Manual, in 1980. It was first proposed by Dr. Robert Custer in 1972, and it wasn't until 1992 that the World Health Organization and the International Classification of Diseases called out something called pathological or problematic gambling. So it's still a fairly modern phenomenon, But the lack of research on recognizing the harm more broadly than this case counting was a long time coming, until in 2016, when a team led by a public health researcher, Erica Langham, so Langham, Brown, Matt Rockloff, Matt Brown, Erica Langham, I've forgotten the rest of the team, published the conceptual framework for gambling-related harm, and they identified explicitly harm to those who gamble, harm to their significant others, harm to communities. And they looked at crisis harm, they looked at legacy harm over generations. They really began to articulate from a public health and quality of life perspective that was consistent with all those other fields what gambling harm was and what it looked like and how it might be measured. And that was a watershed moment in our field. Since that time, a number of other research teams have tackled this idea of gambling harm and developed more refined conceptualizations of it or ways of measuring it, but that was a very important moment, and a very important moment in recognizing not just harm to those who gamble excessively, but to those around them. So this is our adaptation of that model, that conceptual model, and you'll see that financial harm is at the center. And those other harms are the ones that we tend to hear about, and probably the ones that those of you who are clinicians will hear about. The tremendous damage to the relationships, the damage to physical and mental health, the impact on their jobs, perhaps even losing their job or dropping out of school, as Jeremiah spoke about this morning. And in a shocking statistic, and although the research related to this is quite old, across several studies, approximately 50% of those being treated for gambling problems admit to committing crimes to fund their gambling. Usually that's just stealing from family and friends, but that's who we're talking about today, those family and friends. So there's very clear evidence, A, that financial harm is at the core of all these other harms, but B, that we really need to pay attention to the harm to families. And why do I insist on financial harm being the core of it? Well, I think Jim's going to talk to you after me about why that was a pretty important core of harm in his life experience. There is some research in recent years that has pointed to financial harm as kind of the foundational harm from which other harms ripple. For example, there was a team that looked at 7 years of banking data in the UK, several thousand customers, and they found that level of gambling spend was associated with all kinds of indicators of financial hardship. Using an unplanned bank overdraft, missing credit card loan and mortgage payments, taking out payday loans, and being subjected to debt collection by bailiffs. These were all clearly associated, so the higher the gambling spend, the more likely these negative things were to occur financially. Other research shows that of those, that higher rates of financial difficulty are so strongly related to those with gambling problems. 38% report being in debt versus 12% of those who are not experiencing problems with gambling. Sorry, I went too fast. Let's go back. I got a little ahead of myself. We also know that spend on gambling is negatively correlated with quality of life. So we know that those with higher spend on gambling are less likely to spend money on their children's leisure activities, on health care, on financial planning. So it's not just financial hardship, but the whole quality of life deteriorates as the gambling spend rises. And at its highest levels, disability and mortality is higher for those who spend more money on gambling. This has nothing to do with whether they've been diagnosed with a gambling problem. This was just looking at how much money they spent as a portion of their income on gambling. So we know that financial harm destabilizes the family unit. We know that it reduces their quality of life, but we also know that it is both measurable and preventable, and that's why some of what I'm going to focus on in the next few minutes will be how to attack family harm from gambling from that financial lens. So we know, too, that that financial harm echoes or spreads outward. We know that for those who are family members of people who have developed a problem with gambling, you know, these are a couple of statements that we heard from research that is out there now, that small body of research that actually heeded family members, and they talk about the loss of savings, the deterioration of their lifestyle, the tension from constant harassment from creditors, the threats of suicide by the person who has developed the problem with gambling, the social networks not knowing how to handle it and being distanced, or maybe distancing themselves because they've been tapped for money as the arc of gambling has increased. And so it leaves those family members in a very vulnerable state. And they're also expected to provide emotional support to the person who's developed a gambling problem. So it's like a double burden for them. They didn't know what was coming. The person who was developing the gambling problem did. They're suddenly faced with this devastating life situation and the need to support the person who's developed the gambling problem and the loss of social networks and family connections. So this is a pretty heavy burden. We need to tackle this. We need to begin to make that association between gambling and family harm. And one of the saddest sets of statistics is a growing body of research showing a very clear link between problematic gambling and intimate partner violence. So I think the evidence is clear. I'm probably speaking to the choir here when I tell you that this is an urgent issue and that it needs to be addressed. So the last and kind of saddest piece of that picture is that those who are harmed by gambling tend to already be socioeconomically disadvantaged. So we know that gambling problems exacerbate already existing health inequities. So if it wasn't enough that we load all that burden onto them, they were already struggling. They were already below the mainstream in society. We know, for example, that higher rates of gambling are associated with people who are employed and stable and have good incomes and all of that, but the reverse is true for gambling-related harm. You're more likely to experience gambling-related harm if you're unemployed or in unstable employment, if you're in unstable housing, you don't own your own home. All of those social inequities, those determinants of financial and other health, are lower for those who are most likely to be harmed by gambling. So this is part of that case we need to make. We need to say that there's a very clear association between standard poverty measures and standard measures of health inequity and those who are harmed by gambling, and as an extension of that, their families. So as a state, even if you were just being logical, these are the people that are going to be the most likely to need state resources when they're devastated by a gambling problem. So why not address it? Why not stop it? Why not prevent it, or at least reduce the impact of gambling-related harm? So the next thing I want to talk about is why I think we have a policy change window right now. I suspect that for those of you who live in the United States, probably you think that the only part of the global discourse right now is massive expansion, and it's true. This industry is expanding at a massive rate. I've included Gibraltar in that map because it will shock all of you to know, I think, that the British Overseas Territory of Gibraltar, where I'm studying and lecturing, the licensed operators there serve 50% of the global online gambling market. This is a massive industry. There is a great deal of money being made. There are markets opening up in Africa. On New Year's Eve, Brazil announced that they were opening their market. In the US, we saw sports wagering, sports gambling legalized at an unforeseen rate, rippling across the states like a fire, ripping through the country, and it's going to continue. So if you're sitting here in the United States, you might think the only part of the global discourse that's happening right now is expansion of this industry. But Thankfully, that's not the entire discourse. There are very different trends happening in different parts of the world, and they're not even consistent in one part. So in the European Union, which was largely formed around a common market, so it meant that the offering in every economic sector would look the same in every European Union country, and you could provide services from any European Union country to any other European Union country. But they declined to do so for gambling. They said, on this one, we'll defer to the countries to decide how they want and if they want to legalize gambling. So within Europe, you have a very interesting swirl of public policy going on. And if you look at countries like the UK, which is, by the way, one of the biggest gambling nations in the world, probably only topped by Australia. These are nations where there's a deeply embedded culture of gambling and almost no restraints on the industry in those countries until recent years. But now, if you ask an operator or a regulator, the UK is one of the most rigorous regulators and has imposed the largest fines on the gambling sector of any country in the world, and they started a trend. Gambling industry fines increased 400% between 2000 and 2020 and 22, 400%. The other thing the UK regulator did, which I think is really important to this policy window, is that for a very long time, gambling operators said, we don't know about our customers' finances. We have to conduct due diligence to prevent money laundering and fraud, but we keep that information separate. So we don't know who has a gambling problem because we don't know who can afford to gamble what they're gambling. And the UK regulator said, I'm smashing that wall. I'm smashing that wall between the due diligence you do to prevent money laundering and the due diligence you should be doing to protect people from harm. And so they have repeatedly fined operators in the UK for a combination of anti-money laundering failures and social responsibility failures to their customers. And when that first happened, everyone thought it would stop there. It has not ended there. One regulator after another in Australia and other parts of Europe has smashed that wall between the intelligence that gambling operators have to gather to prevent fraud and the information they should be using to prevent harm to their customers. So there is a lot going on out there. There are two very diverging trends. There's expansion, but there is also public exhaustion with the negative impact and increasing public policy will to empower regulators with tools to force and penalize operators in areas like player protection. You see more and more restrictions on advertising and bans on advertising. And when I started talking about affordability, I don't know if some of you know, Leah Nauer and I published a paper on it a few years ago. And, we said, nobody's talking about this, but let's just do it. We'll just jump. And now we have governments in Europe who are starting to implement affordability measures. In the UK, in Germany, and in most of the Northern European countries, affordability is now a conversation. In the UK, operators have to conduct affordability checks after a certain level of gambling spend so they know whether I can afford to gamble at the level that I'm gambling. And this needs to happen. But all of that to say, that public policy window is now. Because you can't affect policy change in stable systems. They're immobile. You can't move them. But when systems are in transition and in flux, when state legislators want to expand the forms of legal gambling in their state, and they want to do so without upsetting their constituents, that's your window. And that's the window I'm saying you and we have right now to tackle family harm. So what would it look like? There are some models to draw on. Family exclusion for many, many years only existed in Singapore and one casino in Auckland, New Zealand, Sky City. It is now in Germany, Macau, and some Australian states and territories. So there are some existing programs where we can go and we can look at how does the program work, who's responsible for it, how is it enforced, that kind of thing. We have some family law interventions. I think probably most jurisdictions in the world now say that if someone's defaulted on their child care payments or something, that those will be taken out of their gambling wins. And we have some really interesting things happening with financial institutions who have profited from gambling transactions from all directions for decades, and yet provided no tools, never used the data they had on who was going down the tubes with gambling spend, and now you finally have them offering tools to prevent people from getting into deeper financial harm through their gambling. So in the UK, I think now almost all the banks, by the way, the UK is the World Banking Center is the UK. And you now have pretty much all of the major banks in the UK offering tools to their customers to block gambling spend altogether, and many of them even offering them limits. So we really have some models out there for what we can build on to reduce that harm to families. And what are those opportunities? What do those opportunities look like? So, I mean, this is just a simple drawing, but what I want to say is that it's going to require new collaborations. I will say that here in Minnesota, you already have more interesting and unusual collaborations than the average state chapter would have. So some of this will be familiar to you. These will be relationships you already have. But I just want to talk a little bit about some of the things that could happen to start to tackle family harm. So if we think about public health and prevention, what about educating families on the possibility of gambling harm, ways in which to conduct a financial health check if they have any concerns, a guide to having a conversation with their family members about their financial health, a guide to how to talk to financial institutions to address gambling-related harm that they're experiencing, a massive education program so that suddenly this will be taken out of the shadows, and we'll start to talk about the fact that families are being harmed by gambling and give them the tools, which is public health's job. They identify risk, and then they give people the tools to stop harm and to make better choices. So let's engage with public health. Treatment providers for a very long time have been providing care to families, but without explicitly having funding and support for it. So we need to have not only explicit funding for problem gambling treatment, but it needs to include family treatment, and it needs to include treatment for family members who want to be treated alone. So we really need that to happen. And I know that when Jim speaks in a little while, he'll talk about the GamFin financial services, but that's the other piece, is that treatment providers have to understand that when you're facing someone with a gambling problem or a family member with a gambling problem, what distinguishes them from any other disordered behavior or substance use behavior is that the financial harm has to be stopped before you can address any of the other issues. You can't tell the husband or wife of someone who's devastated their finances through gambling to start working on self-care when they're not sure they're going to keep the house, when they don't have funds to send their kids to college. You have to work with them to tackle that family harm and take advantages of services like the one that Jim's going to talk about as treatment providers and stop the financial harm before you can start to address those broader life issues. Researchers, we have to call upon researchers to incorporate the voices and data from families in their research more. And for those of you who work with families, reach out to researchers, offer to collaborate with them. Let's get more data, because that's what we need to take to public policymakers. Financial services sector, this is one of the biggest. There's a whole strategy around the financial services sector, and I won't get too much into it, but let me touch on a few of them. First of all, tools for you to set limits on your gambling spend, tools for you to block gambling spend, and very, very important, when two or more people own a joint financial product, why does the bank not sit down with you and have a conversation with you about the risk tolerance and the permissions that you're going to give each other around those joint financial products, so that one of you doesn't wake up one day and find out you're devastated, that every joint financial product you had is gone, and you never got alerted by the bank, you never got the opportunity to give permission, You never had initial conversation with the bank where they said, these are the risks, and to mitigate those risks, these are the tools we're offering you as joint account holders to hold each other to account for your behavior in these shared financial products. And their data, that data needs to be used by researchers to understand these behaviors better, but they have the data to know that someone is going down the tubes with a gambling problem. We need them to be empowered and required to at least intervene with that person and say, we see trouble here. Do you need some help? Does your family need some help? So there's a great deal that financial institutions could be doing, including working with you on those financial health checks for families and opening their doors to joint account holders and families to come in and have those conversations about their financial health. But as the young woman over at this table identified earlier, legislators, policymakers, these are the core. These are the folks who can, for example, when a gambling regulatory framework is developed, there is a definition for who is vulnerable and therefore requires more protection. Why aren't the family members of those who develop problems with gambling considered to be vulnerable? Because if they were explicitly part of that definition, then they would be eligible for services and supports. So that's one of the things we could work on. But we can also work on them providing explicit funding and support for some of these other broader initiatives and reaching out to other sectors like financial regulators to talk about what banks can do to stop this family-related harm. So these are just some of the collaborations. The other one I meant to mention is that just quite fortuitously at lunch, a woman named Sherry sat down at my table, works with a family program so to support family members, a residential program to support family members of people who are experiencing addiction and related disorders. So that's another resource for treatment providers, is to reach out to those kinds of services. But what I've tried to do is give you a sense of what can and should be done. You know, from the operator's perspective, usually I don't let them off this lightly. I mean, you hear some pretty nightmare stories over the years that I've been speaking about this issue. We did a workshop at NCPG a couple of years ago, and I listened to clinicians and regulators and others, and in the years since have consulted with regulators, financial experts, privacy experts, others, to talk about what could be done. And you hear stories like a man who worked with his daughter providing financial services. His daughter developed a problem with gambling and was at the casino in a VIP room gambling, and he went to the casino to stop her from gambling their client's money, and he wasn't allowed to go in. They would not let him in the room. A regulator told me a story about how a man came to the casino in the middle of the night with the baby and said, I need my wife to stop gambling. Our family is bleeding. She needs to stop gambling. And they wouldn't stop her from gambling. They couldn't stop her from gambling. He tried to drag her out of the casino, and he was charged with assault and had to leave in handcuffs while his wife continued gambling. And this regulator said to me, we don't have the tools. We don't have the legislative tools to force operators to act in response to third-party concerns. So that's that loop. We need those family members to be considered vulnerable. We need that definition. We need to go to policymakers, and we need to fix this problem at the base, at the foundation. So what I want to ask you to do today is to think about one initiative that I think will have the most impact, and that's a family exclusion process. And I want to tell you that I don't bring this lightly. This model is based on a charity that I'm involved with called Here to Help, which is entirely focused on helping families of people with a gambling problem. It's based on academic research, on talking to regulators, financial privacy experts. And even in the absence of any legislative or regulatory action, this is a process you could implement. And the principles are that it would be rigorous, it would be just, it would be effective, it would be informed by the programs that are already operating globally, and it is designed to address those concerns around malicious submissions. Like, this is the thing that everyone always says, oh, what if someone maliciously says I have a gambling problem just to stop me from gambling? Well, if you have a rigorous process, it's going to stop those. Privacy concerns, safety concerns, we've looked at all of these issues and tried to develop a model that we think will work. It needs to be well promoted and highly accessible to family members from all cultures who don't have English as a first language, so multilingual, and it needs to be adaptable. So the structure that we've developed, we believe, hits all of these buttons, and that is a nonprofit or charity organization in your state that develops an online platform to facilitate the application process, correspondence, notification. That same host of that platform has gone out into the financial services sector and the legal sector and asked top executives to volunteer 2 hours a month, 3 hours a month of their time to be expert reviewers of these applications. You have one staff person, probably for the entire state, given the volume that I've seen in other jurisdictions, who reviews, well, first, in consultation with those experts you've recruited, you confirm the application process, the forms that have to be completed, the certifications you have to receive from banks and others that all of this evidence that's been submitted is in fact real evidence. So you have that staff level review, very clear documentation requirements, and a 2-stage review. Staff reviews it, makes sure everything is sound and legit. It's sent out to, let's say, 2 of those experts, and they look for 2 things. Is there evidence of financial harm to this family? And is there evidence that that financial harm is tied to gambling? And then they make a recommendation. These 2 experts submit that recommendation, and then this same host sends that recommendation to all of the authorities in the state. The regulator, operators, financial institutions. Nobody knows where the application came from, but they know that the process by which it was adjudicated was previously determined to be a good one. They know that experts reviewed it, and they know the recommendation. And if they decide not to comply, and that person causes further financial harm, well, you can guess what happens next. And when I speak to regulators about this model, their eyes go wide and they say, I would love to see this in my state. I would love to see this, because this takes the complexity of it out of the courts, out of my relationship with the state. It makes this a very actionable recommendation, and compliance with it is completely voluntary. So I'm asking you today to consider undertaking putting a family exclusion process in place here in Minnesota. So one of the things I learned while I was preparing for today was that you led the nation on secondhand smoke, and you probably don't know that. I think it was 1954 when the first British Medical Journal article linked lung cancer to smoking. I think 1964 when your first Surgeon General's report acknowledged the health risks of smoking. But in 1975, I think that's the year, yes, Minnesota was the first state in the nation to implement the Clean Indoor Air Act, the first statewide law that required separate smoking areas in all public places. It would be 13 years later that your Surgeon General's report would officially recognize the dangers of secondhand smoke. 13 years after Minnesota led the nation with the Clean Indoor Air Act. And of course, after that 1986 Surgeon General's report, other states followed suit. That recognition of secondhand smoke and the risks of it is largely seen by the public health sector as the wedge, the primary driver of subsequent developments in smoking cessation. That was the policy wedge everyone needed. So I'm asking you today to consider leading the nation again. Thank you.
Thank you, Judith. That was wonderful. And when Judith and I were talking about her preparation for the program, she was like, "Can I be controversial? Can I make a suggestion?" And I'm like, "Absolutely, please bring it forward." And so I'm so pleased.
Well, and just to be clear, I sent my presentation to Susan 3 times. The notifications that the file was too big went to my junk folder. She never received it. So Susan did not know what I was going to ask you to do here today.
And I'm glad we're being asked to consider this. So we have some time for questions. Mike.
Thank you. First of all, looking at third-party harm, I think, is absolutely brilliant as an end to talk to legislature about everything you just talked about. I think that's a very interesting way to look at it, and it seems to make a lot of sense. As far as the family exclusions, you said that it does exist somewhere. Is there a resource to get more information about how it has worked? Susan and I have talked about voluntary exclusion statewide, which is with, I don't know how many different tribes we have with casinos. I think it's 14 or 11 tribes. It's something that we've talked about a lot, and something that we assume it's very difficult to instill in the state. Going with the family model is exponentially, but I'm an operator. Hi.
Hi. Well, and frankly, operators have said to me they would welcome it.
Yeah, I've experienced similar situations to what you talked about with people coming in and saying, I want my husband removed. People calling me and say, I want you to take me off of I want you to take my husband off the mailing list. We have a problem in this house. We haven't dragged anybody out or arrested anybody, but it emotionally has touched me maybe more than any of the other things there. So absolutely fascinating what you had to say. I would like to know where it exists and how that model's working, and any data on its implementation and its efficacy.
I don't have all of that with me, but I will definitely share what I do have. So I did an extensive interview with the program leader in Auckland, where I asked them how many malicious applications, how many applications a month. So I have all of those numbers. It's surprisingly small. I think that they determined that potentially 4% of applications were malicious, but they determined that because they dropped the application when the investigation started, which to me doesn't prove it was malicious. It might prove actually worse things than that. But in any event, the rate of applications you'd be looking at for a state the size of Minnesota is probably less than 20 a month, if that, 10, 15. But yes, we could certainly get more data. In terms of the models, they vary. So in Auckland, it's one casino. In Germany, it's national. In Australian states, it's state level, but also gambling sector specific. So clubs don't have it, but casinos do, that kind of thing. So the models really vary. There isn't any jurisdiction other than Singapore that I know of that has a completely comprehensive, encompassing all operators and all forms of gambling in the nation, and that's the Singapore model, and it's the one that's done the most research. Also incredibly positive outcomes for families, because the family members feel empowered. Not that the gambler necessarily ever knows they were the ones who did it. The person simply gets excluded. So in New Zealand, for example, when they sit down the gambler, they say, we've noticed you're gambling too much. We've decided to exclude you. They never name the family member, and you don't need to. In fact, you probably shouldn't.
So if they get the exclusion, I guess I'm confused as to what actually happens. So, like, they can't go, like, the person who is gambling cannot go to the casino. They'll just say, no, I'm sorry, you can't.
Exactly.
You can't
So-
be here, right? So what about the financial downfall from this? I mean, is the family not going to be responsible then for, you know, the debt or whatever? Is that also excluded?
Such a good question, such a good question. So because it's voluntary, if that casino decided to continue to accept that person's gambling, then you would have leverage for a lawsuit.
But the past debt, is that going to be forgiven? Or no?
Not in this process.
That's not in that
No.
process?
It's a really good question, though. So, for example, in most jurisdictions in the world, if you can prove that the money was fraudulently obtained to gamble, then the gambling company has to refund it.
And how would you prove that, though?
That's where you need this.
Because they would say
that's where you need this definition.
That's voluntary, I mean.
Yeah.
And
But
so,
if you can show that the family member didn't consent
okay.
and was supposed to be allowed to consent, so therefore it was fraudulently obtained, that's why I
Mm-hmm.
think the family exclusion process and the definition of vulnerable are the biggest policy levers we can push.
so if they do get this, and then let's say the person goes back and gambles at a different place or whatever, and they don't know about it, the family doesn't know about it, you know what I mean? Like, could
So
they go to a different
the
casino
process-
and no one would know, you know what I mean? And then they
So
just keep doing it.
the host of the program would
Yeah.
notify every operator in the state and the state regulator.
Okay, I just have
They
one
would
other
all be notified. What they decide to do with it would be voluntary, but you would be able to say to that operator, you were notified on such and such a date, and you let that person come in and gamble 2 weeks later.
It's sort of like a restricted medical assistance. That's what they do, and I think it's a great idea. But I just have one other question for the credit cards, you know, because I think people go in and they max out all their credit cards. That's what I've seen. So is there any way that they can say, okay, well, no, you have a limit on
Yep.
this?
So
They
this
can do that,
this is
right?
the banking tool. So right
Okay,
now,
thank
you
you.
probably get in your financial statement, your spending by basket, right? So it'll show you how much you spend on entertainment and housing, and, you know, so they know how much you're spending on gambling. So they should provide you with a tool where you say, that basket called gambling, I don't want it to go above $100 a month. And if it does, don't approve the transaction. Stop it at the source. That's the kind of tool that's available in the UK. Not here. And for that, I would start with the financial institutions that are the disruptors, the early entry, the recent entries into the market. They're going to want to differentiate themselves. That's who I'd go to first.
I love what you said about education at a bank level, but I'm curious how you how you track that destructive spending that's going towards gambling when so much gambling is done in cash transactions.
Yeah, so it depends. Cash is very rare in Europe. Almost, and some countries have moved to no cash economy. So you always have to use your debit card or your credit card or some kind of e-wallet. So you're right that we don't have a solution if someone takes hunks of cash out of the bank account and goes and spends cash at a casino, but you could require gambling operators to not accept cash. And that would be consistent with anti-money laundering requirements, because up to, in Canada, it's $4,000. If you get close to $4,000 in cash, they have to do a source of funds check with you. They have to make sure that's legal money. So if we even went with those lowered those thresholds and said any cash spend above this amount, you have to use your debit card or your credit card so we can see that it's coming from a legitimate bank account and it's legally obtained funds. That's how you would solve that. But this won't solve cash-based transactions. You're right about that.
But Judith, couldn't you ask, if we get the financial institutions involved, that, again, you set a limit in terms of how much cash you're allowed out in a day? I mean,
I really think that that conversation between your bank and joint account holders, that's a place where you can stop so much of this. You can have a very explicit conversation together about what is fair to both of you or three of you or however many are sharing that account. That, the financial institution should be facilitating that conversation.
any other questions? Go.
Has this been applied for online gambling? Are there,
So online gambling in much of the world now, and certainly in the US, has to be legalized through a licensing framework. So each of the 7 states that now has legal online gambling and the 35 or so that have online sports wagering, they have licensed a specific list of operators to provide that service. So you would just include them in the list of operators you informed.
Okay, I think we've covered it.
Yes.
Oh, there are other questions. Oh.
New to this space, right? And I understand that we're trying to stop people from gambling and going there. Like, who's volunteering? Is it the family member or the person? First question.
So the voluntary aspect that I was talking about is the gambling operator. So the
Okay.
gambling operator will be informed
Okay.
that my partner has submitted an application to prove that I'm causing financial harm to the family, and an investigation showed that the documentation they submitted was legitimate. The investigators, the experts reviewed it and said, yes, there's harm, and yes, it's linked to Judith's gambling. Now, the organization sends a notification out to every gambling operator and the regulator in the state and says, experts have determined that this person should be excluded, but it's up to you to comply. It's voluntary for the operators to comply with the recommendation of the experts.
Okay. Because as I'm listening, I'm like, aren't you violating a lot of rights? Like people's rights to choose, you know? So, okay. Okay. But so then where does the lawsuit aspect comes in? Because if they have a choice.
So let's say that a process is rigorous, the application's legitimate, the reviewers have determined there's clear evidence of harm to the family and that that person should be excluded from further gambling, and you're a gambling operator and you get that notification and you defy it. You let me come in and gamble away the last $100,000 of my family's savings, and then my family says, wait a minute, you were notified as a gambling operator 3 weeks before you let Judith come in and finish off the financial health of my family, we're suing you.
But if they're telling them, okay, you got this, you can't gamble here no more, but they're telling them you can't gamble right here, and they choose to still go and gamble.
Well, so, no, because you have to be permitted. So when you gamble either online or in a casino, they have to let you in. So basically, this would be saying you have to, the same way as if someone had self-excluded or if you'd excluded them from because they card counted or cheated, you have to treat them like that. You exclude them as an operator and you do not allow them on your premises to gamble. That's the way they would implement it, if they comply.
It seems like there's a lot of laws being broken, and then I get the concept, but it seems like there is, because as a human being, we have freedom of choice.
Gambling operators exclude people all the time to protect their own bottom line.
Right.
They exclude people who card count, which is not illegal, by the way. It's just a skill. It is. There's nothing illegal about card counting, but you will be excluded from every casino in the country if you can card count. So they can exclude you for any reason. They can exclude you and say, I don't want to sell you any more gambling because you're devastating your family and I don't want to be held liable for that. I've been notified. I now know that your family is being harmed and I don't want to be party to that.
All right. Thank you so much.